let me walk through just some basic stuff. And people have read this, but I think it's helpful that somebody who's maybe their neighbor and from a local hospital to go through. Just so, symptoms. What are those symptoms that should concern someone or not concern someone?
So one of the important things to realize, the symptoms are fairly distinct. It's fever, cough, and then lower respiratory difficulty, breathing or chest pain, really lower respiratory. This virus doesn't have a lot of the typical runny nose and congestion, things that we see with flu and with some other cold viruses.
All right, as we tape this on March 19th, I think here, what if you feel those symptoms, what should you do?
You should call your physician or you should call in to somebody that you trust. And if it's mild, you're going to be told stay home, manage yourself at home. Don't come to the doctor's office. Don't go to the ED. If it's serious, you can't breathe, you're having trouble with your breathing, you're worried, then you go to the ED, but call ahead to the ED to tell them you're coming.
That difficulty breathing, just to clarify, is different than a cough. Just for not for a layperson, right. The difference between a cough, even a bad cough, and the lower respiratory that you're talking about.
Right, so a lot of us are coughing right now because allergy season is coming in and we got some nasal drip and things like that. So you're going to have a cough. Difficulty breathing is typically chest pain, difficulty getting your air out, fast breathing, labored breathing is what we're talking about.
If you don't have a doctor that you can call, who do you call?
Well, I would normally say the health department, but the health department is being overwhelmed with calls right now. So this is, again, is one of our gaps in care we have right now, that we have so many uninsured who don't have a physician and don't have somebody they can call.
Are the organizations, and I'm not endorsing here, but like Christ Community, like Church Health Center, some of those, are those places that people without insurance, without a regular doctor should turn to?
They're really stepping up right now. So I do think, what we call our federally qualified health care organizations like Christ Community and others are great places to think about.
Is there a list of those that you could send people to? Do you go to the Shelby County Health Department? They have a list of other alternatives for people to go, again, if they don't have a doctor?
I don't know that there's a comprehensive list. Okay. I have one myself. So I will put it up on our UTHSC coronavirus website.
Okay, and if you were exposed to someone, if it turns out your child, your mother, your girlfriend, your husband, whatever it is, has it, you were exposed, what should you do?
Well, first of all, I wouldn't panic, right? So we know for most people under the age of 60, this is fairly mild disease. If you're over 60, maybe there's a risk for more severe disease. So I would not panic. I would keep doing the same things we're doing with the social distancing and with trying to take care of yourself and wash your hands. And then if you get sick, make sure your healthcare provider knows you were exposed.
If you get it, and people in Memphis have, and more probably than even know have it, right? That's part of the mystery and the murkiness of where we are. It runs its course. I'm acting like I'm a doctor here, but it runs its course. What are the long-term consequences for people? I've had the flu before. I've had the flu multiple times. Is it like that it's a really miserable period of time and then you just go about your life, or is it long-term damage?
Well, we think for most people it would be like the flu and you're going to be okay. There are some cases we're seeing now, including in young healthy adults who have it, where they're suffering lung damage that probably will be a chronic respiratory issue for the rest of their life. So again, we're not seeing a lot of deaths in young adults, but we are seeing infections, we are seeing severe infections, we are seeing some of this damage.
Thank you, Dr. McCullers, and you can go to uthsc.edu/coronavirus for more information.